Hi, it's Noel Williams from Optimal Health Associates. It's Wednesday night, March 4th, 2020. I'm going to do an interval report on COVID-19 because I think we have some major things about to occur. Between reading the tea leaves, seeing what's gone on, and some information I've received, I think people need to be aware that the COVID-19 pandemic is about to erupt in the United States. I think it's pretty likely that there's going to be a massive increase of infections in the next 48 hours up to the next, and then ongoing. There's some reports that I've received that California is going to start having a tremendous number of cases in the next few days. Part of that is the CDC finally is getting some testing kits out after not having them available, and so that's one of the reasons why there may be a big pop, but the problem with that is that means all those people have been around all these other people. In the Oklahoma City area, there are approximately 200 people in quarantine per a CDC officer, and they're expecting that number to go higher, and many of those people to be infected is what they're anticipating. They've notified the VA that to be prepared for those types of patients who are veterans to come in the next few days or so. And so the CDC is kind of behind the scenes letting everyone know to expect the pandemic to hit. They're not making that public yet, but since I've heard this from, I think, some fairly reliable sources, it makes sense to me that that's going to happen, and I want as many people to know that what we've been worried about is finally going to probably, unfortunately, get here. Again, I hope I'm wrong, but I want everyone to be aware and prepared. So preparation means take your zinc. Number 2, if you start getting upper respiratory tract infection at all, so you just think you have allergies or something, err on the side of caution, and then take 200 milligrams of zinc, but you do it in divided doses over 4 hours. The whole point is, if you take the zinc in the first 8 to 12 hours of symptoms and you do a bolus or a bunch of it, you're going to abbreviate or stop the viral replication very effectively. So you take 50 milligrams every hour or so for 4 doses to equal 200. 50 times 4 is 200. 200 is the magic amount it looks like to get in to really turn up your anti-zinc fighting mechanisms against the virus. So I can't emphasize that enough. Everyone needs to start using Clorox wipes or Lysol wipes whenever you touch anything at a gas station or a gas pump. You need to then use hand sanitizer. You need to wash your hands for a good 15 or 20 seconds in hot soap and water if you don't have hand sanitizer. And you need to stop shaking hands, hugging people, or doing all those things. I'm sorry to be more aggressive or not as friendly tonight, but I'm very concerned that what I've worried about so much is here. And we just have to go with the hand we're dealt and get through it as a city and as a country and as a world. I think the CDC will eventually be able to do some things to help us. So far, I think they're definitely a big letdown. I don't mind saying that. But ultimately, we have to be ready, so people need to take their zinc. I just want to address 2 other things. I've gotten some emails about colloidal silver. Colloidal silver and silver products are antibacterial. There's not good literature for it being antiviral or any literature on RNA viruses. I think it's a total waste of time, so I would not encourage you to do that. I posted an answer about vitamin C. Vitamin C has been looking for an indication for viral therapy as an antiviral therapy for 40 years. There's no data to support it. I'm sorry. Vitamin C is a great antioxidant if you're on chemotherapy. There's lots of things I would use it for. There's no data to show that it's an effective antiviral. So it's zinc and a multivitamin. That's the focus. Wash your hands, do those things. I will update you every few days at this point. and we'll keep our fingers crossed that the people contacting me are incorrect. Sorry my phone's ringing, but I have a lot of people calling me right now. You're in my thoughts and prayers. Good night.